Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Chris Peterson, a well-known local dentist and the founder of the Wisconsin Tongue Tie Institute in De Pere, Wisconsin. Dr. Chris specializes in releasing tongue and lip ties for patients of all ages with a special focus on infants. His journey into this specialized field comes from personal experience, as his own daughter Audrey had a tongue tie, and as a dad, he had to navigate the challenges firsthand. Since having his own practice, which started in 2017, Dr. Chris and his team have and continue to make a significant impact by offering not only oral tie revisions, but also in-house support for lactation, myofunctional therapy, speech therapy, and more. Beyond his work, Dr. Chris enjoys spending time with his wife and 3 kids, hunting, fishing, and cheering on the Packers. We're excited to have him here to share his expertise and to answer a lot of your questions related to tongue ties, orthodontics, mouth breathing, lactation challenges, sleep apnea, and more. So without further ado, let's dive into today's conversation.
Hey guys, welcome back to the podcast. We are here with Dr. Chris from Wisconsin Tongue Tie Institute. We are super excited to welcome him back for our 4th episode. We had some phenomenal conversations about tongue tie, about myofunctional therapy, about lactation support, not just what his office can help you with, but just all these tips and all just education. And that's what this podcast is all about. And we're super excited to welcome him back. We're going to be talking about airway health and why the importance of it, and just delving into this a little deeper. So, and this isn't just for kids. This is for like adults too, for sure. So maybe some of the things we're going to be talking about today are going to kind of irk you a little bit, because we might be talking about you. So airway health. So why is this even a topic that we should care about? I mean, we're talking about breathing. We breathe all the time. Like, what is the big deal about this?
Yeah, well, we all breathe, right? So everyone's affected by this first and foremost. So, there's definitely a proper way of breathing and an improper way of breathing. I don't know if you've been on Highway 41 recently, but there is a sign, I believe it's an ENT clinic, that says breathe here, and it's an arrow pointing into the nose. And I loved that. I tried to take a picture of that and post it, on our Facebook page. But I loved it. I'm like, yes, the research is getting out there, and people are knowing that there's a proper way of breathing, and we're going to be so much healthier. We're going to sleep better if we're doing it properly.
And that's a really interesting point, is that it is becoming more mainstream, and people should be breathing out of their noses or through their noses. Can you tell us a little bit more about what is the ideal mouth and airway structure compared to your dentist? You're looking at people's mouths all the time. So what are you seeing today?
Yeah, for sure. I mean, you don't even have to be a dentist to spot these things. And when I say these, you're going to start seeing people in the streets. Forward head posture is a big one. You're going to see people that they don't even know that they're doing it, and that's just how their body has grown, and their spine has grown because of they need to open up their airway to breathe. So you can see them when they're sleeping too. Their head's up. They're just kind of arched up in the wrong way to open up their airway. The same way that we're supposed to do CPR, right? When we're supposed to open up someone's airway, you tilt their chin back, and that opens up the airway. But if we're compensating because we have a closed off airway because structurally we're not built appropriately, then those are the things you're going to see. In the mouth, it's really easy to, if you're a dentist, you know that the arch should be U-shaped and not V-shaped. That's something that we talk about all the time. That's pretty easy to understand. The tongue really is the scaffolding, like we talked about before, for that upper jaw. So if the tongue can rest on the roof of the mouth and your mouth is closed and you're breathing through your nose, your tongue is up and your upper jaw just is a nice U shape. It's beautiful. And we got room for our tongue up there. If it's a V shape, It's just narrower. Our teeth are crowded, so you're going to need orthodontic work to fix that. But our nasal passage is therefore smaller, and it's just harder to breathe through a smaller passageway, right? We're going to have turbulent airflow, and we don't want turbulent airflow because if it's hard to breathe through your nose, what do? You open up your mouth, and then the problem gets worse or it doesn't get better.
Yeah, absolutely.
What age should parents start thinking about or paying attention to how their child is breathing?
And how do they know it's a problem? Like, what are the signs?
Yeah, so from day one, like I say, with all the parents of infants that come in with their little ones, we say, hey, pro tip for you, close their mouth when they're sleeping if their mouth is open, and try to suction their tongue to the roof of their mouth if you can. You can kind of peel their mouth open or their lip and kind of watch that tongue stay suctioned, and then you can break that suction, and you're like, okay, I know I'm doing it. So from day one, you want to make sure your kid is, or your infant or your child is breathing through their nose. And an older kid, and I guess the age doesn't really matter. If you can hear your kids sleeping and breathing while they're sleeping, that's a problem. I mean, that is not normal. That's turbulent airflow, right? Mouth or nose, doesn't matter. We shouldn't have turbulent airflow when we're sleeping. So I always tell parents, hey, tuck your kids in, and then when you go to bed, right before you do, just go check on them. Just open their door. And if you can hear them, not good, okay? And if they're snoring heavily, really not good, okay? Because sleep apnea is a real deal in kids, not only adults, but we see a lot of cases where, not a lot, but we see some cases where it's really severe and the kids are not getting oxygen, and then we got behavior problems and we're not sleeping well and we're restless, all the things, So we want to make sure that we're mouth closed, breathing through the nose.
So behavior problems are a huge thing in school and stuff too. Some kids might even get diagnosed with ADHD or some other things too, just because maybe they're not sleeping well too. These are just things to consider.
100%. Yeah. I'm not a sleep expert, but I know that there are deep stages of sleep. Everyone thinks REM is the deepest. It's definitely not the deepest. We want to get to that N3, I believe it's called, stage of sleep where our memory really gets locked in. So we have memory issues if we aren't reaching those stages of sleep. And it's just not restorative sleep. We don't feel well rested if we're not getting to the deep stages of sleep. And if you're mouth breathing, it activates that sympathetic nervous system, that fight or flight, and it doesn't allow the parasympathetic or that rest and digest nervous system to really go, and therefore we don't get our battery recharged.
And you also had mentioned that when you're breathing through your mouth, your nose cannot filter then. Your mouth is not made to be a filter. So then are you bringing like germs and viruses in through your mouth? Is that why kids are, not just kids, I guess adults too, anyone who's mouth breathing, are they more sick typically? And then does that also affect their tonsils or the adenoids, things like that?
Yeah, absolutely. 100%. If the mouth is open, it's dry, right? And the saliva protects our mouth, not only our teeth and our gums and fights off bacteria, but it also protects our tonsils. And if you're breathing in through your mouth, those viruses and bacteria and all dust and all the things, allergens, they're getting in and they're getting trapped by the tonsils. And guess what the tonsils do? They get inflamed. And then we get big tonsils. And you can, stick your head back, say, look in the mirror. You can evaluate yourself with a light, if you can, if you got an open airway. You can see what the tonsils are doing. If they're big, we classify them on 1, 2, 3, 4 scale, depending on if they're taking up 50%, 75%, 100% of the airway. But that leads to airway obstruction, big time.
And so that's why kids are getting their tonsils taken out. I mean,
100%.
and then they wonder, and then they still aren't fixing the problem because they're still mouth breathing.
There you go. Yeah.
Oh,
We're getting somewhere now.
So to summarize that, do you feel like if the population, if this became mainstream, this information and proactiveness, right? When the babies were little, if we could do exactly what you said earlier of like helping them make sure that they're closing their mouth and then they're breathing through their noses, would there be, I'd be curious to know how many like tonsil removals and like adenoidectomy, I think that's what it's called. How many of those would actually be happening still if everybody was nasal breathing?
Yeah. I mean, nasal breathing, you could Google it and find a whole bunch of benefits, but I mean, nitric oxide is released from your sinus passages. It gets into your bloodstream. It kills viruses and bacteria, and it just makes oxygen get delivered better to the rest of your body, by the way. So you just feel better. But yeah, we want to get ahead of things. That's why we love seeing infants, and that's why, when we hear certain, medical providers in the area say, you know what, your baby's gaining weight, don't worry about the tongue tie, it's not an issue. And they don't really think about the long-term impact of, mouth breathing or the improper dental development and stuff like that. It really sets us way behind the 8 ball. And then we got to catch up with therapy, tongue tie release, and really proper breathing and, opening up nasal passages, stuff like that. So yeah, prevention is key.
So you talked about that U shape that you want to have on the top of your mouth instead of a V shape, which makes sense because then it's not impacting into the nasal cavity, limiting your nasal breathing. But like for someone who has a V shape, what are the options for mouth expansion?
Yeah, great question. And that's a two-part answer. If you got an adult versus a child, that's a much different answer. And then if you break it up age-wise, if you got an infant all the way through age 5-ish, there's removable orthodontic options. I like to call them pre-orthodontic options, Myo-Munchie, tooth pillow, stuff like that. But then you get age 5 and above, and you can actually get some orthodontic hardware in a kid's mouth, and it's a fixed thing. Generally when they get their 6-year molars, you can get a palatal expander. Or, there's rapid palatal expansion and other forms of that. But if you can get it to be a fixed appliance, then you don't have to worry about compliance as much. Because these kids, it's tough to wear a mouth guard when you're sleeping and stuff like that. But if we can get something locked in their mouth, like my daughter's going through palatal expansion right now. Not only on the upper arch, but on the bottom too, which can be a controversial thing. But I've been monitoring that myself, and our orthodontist that I'm working hand in hand with, she's been great to work with. And she says, yep, evidence supports this. And I saw the studies, and I just kind of crank something open a couple times a week, and it's 1/4 millimeter per turn. So it's not a whole lot, but 8 months later, all of a sudden we're nasal breathing and we're not wetting the bed, and there's space for the teeth to come in. And that's what I'm looking at, is I want to make sure that the adult teeth have space to come in.
Yeah, absolutely.
So,
because I think a lot of times when people think of braces, it's just aesthetics, right? Like they want a straight smile. So are braces themselves also helping with palate expansion, or is that something you need to do ahead of time before you get braces?
Yeah, so it's like phases, right? And my orthodontist pals out there are going to get maybe mad at me, but there's phase 1 ortho, phase 2 ortho, and my understanding of that is it's early intervention, like palatal expansion and kind of just fixing the big structural issues, and then you got phase 2, which is a little bit more fine-tuning. So yeah, the early orthodontic expansion is what we want to get ahead of as fast as possible. And if we can get an orthodontist to get in there, they're taking referrals at age 4. We got a couple of them that are doing that and looking at like Invisalign to expand the palate and things like that are removable. But yeah, and then fixed expanders too.
I would say it all depends too, right? Like on the compliance, on the age, on the kids,
100%.
on where they're at, or adults. I know I had braces as an adult too, and my mouth didn't need a palatal expansion, but the braces did help with that. And yeah, I needed more space too, so it did work out. But
one thing that maybe some of the listeners can relate to that I always talk about with parents is. Airway orthodontics is becoming, that's what kind of the term that we're using to say that we're actually paying attention to the airway as dental professionals. And some orthodontists say, I don't treat airway, I just fix teeth. And it's like, okay, good for you, but don't hurt these patients, and by that I mean they a lot of times have in the past recommended extraction of permanent teeth because your mouth is quote unquote not big enough. Well, guess what? You're closing off people's airway, and then we get people that are having snoring and sleep apnea later in life. So we, by and large, are getting away from that and working with the orthodontists that want to expand the mouth, and make room for those teeth and find a way to do that and open up that airway versus extracting teeth and crunching people off. So if you had teeth extracted, like my wife did when she was younger, she went 4 premolars are gone, wisdom teeth are gone, and wisdom teeth I'm still fine with, but the premolars, it's like, let's not extract them if we don't have to. Certain situations I understand, like you can't help it, but if we can open up airways as opposed to closing them off, that's what we want to do.
That's a really, really good tip. I've heard that too. And so if anybody's listening, if your ortho is telling you that you need to remove premolars, maybe question a little bit. Maybe have some more conversation about that.
You bet. Just ask them about it. Yep.
Yeah.
And now you're also a general dentist. So you are with Pere Smiles, but then you also opened Wisconsin Tongue Tie Institute. So you're looking in people's mouths all the time, like we've talked about. Are you screening, like in your own mind, are you kind of screening every single person that comes into your office for airway issues? Yeah.
And not just me. We have hygienists that are amazing. I absolutely love everyone on our team. So if you're listening to this and you're on the team, you're my favorite. I love all of you. But our hygienists are special to me because they are so open-minded and they want to learn. And we said, hey, sleep disordered breathing, which means you're not breathing appropriately when you're sleeping, and that could be snoring, sleep apnea, upper airway resistance syndrome, stuff like that. If we want to really change the world, let's screen all our patients for it. So Fairest 6 is the screening tool that we incorporate in the office. That's a Dr. Zaghi thing from the Breathe Institute out in California. But there's really good research to say that you can really figure out who's mild, moderate, or severe for sleep disordered breathing. And sometimes you already know when they walk into their mouth breathing, you know that they're going to be severe. But if we're incorporating that, we're having conversations, and that's where we pride ourselves in, not taking the easy way out. Because we don't really. It's hard to have those conversations with parents. They come for their dental appointment for however many years, and then we finally bring something up because we learned something new and we want to change lives. And it's tough to have those conversations. So I applaud all our team members for going above and beyond and really looking out for the patients, because they might not want to hear it. And we're not super forceful. If they don't want to talk about it, let's not talk about it. But if they're open to it, hey, let's tell you how we can help you, with all those airway concerns.
Mm-hmm. And that's where I feel like this education is so important, right? Because it's hard to share everything we've shared in these 4 episodes in a 5-minute, hey, I'm noticing this. Here's why it's important, right? Like the education and the understanding of the long-term effects is really what's going to make somebody understand if this is a journey they want to walk down or not. Something you have mentioned a lot, obviously, is sleep in general. So I'm curious if you offer sleep studies in your office. That seems like something you have to like go to a hospital and get hooked up to a bunch of coils and whatever, like those really awkward things. But how do you know if somebody's sleep is being impacted as a dentist? Is there a way?
Yeah, absolutely. First of all, we look in their mouth and we kind of know the answer before we ask the question. If they got a huge tongue and their airway's tiny and they have a big neck and some of those telltale signs that they're at high risk for snoring or sleep apnea. So we see those patients in our chair and we ask the question, hey, are you snoring or have sleep apnea? And when they say yes, then we're going to lead them down the path of, hey, we can examine this a little bit in more depth. And if you want to have that conversation, we can help you, because sleep apnea, untreated sleep apnea will take 8 to 20 years off your life. And that's proven. So
holy cow. Whoa. Can you say that again? Did I hear you correctly? 8 to 20 years?
Take it right off your life. Yeah. If you have untreated sleep apnea. So that's where I get people's attention when I say that.
Yeah. You got ours.
Mm-hmm.
Yeah.
Mm-hmm.
Wow.
So if somebody goes down this journey, can they cure their sleep apnea?
There's a lot of things you can do for sleep apnea, to help them. And to answer your question from before, sleep study, right? That's the first step in the process is you want to make sure you get a diagnosis, whether that be primary snoring or that be mild or moderate severe sleep apnea. Right now, we currently don't, but when we air this podcast, maybe we will be able to send sleep studies home. That is the next thing on our list, besides finding another myofunctional therapist, is to start offering at-home sleep studies. No, you don't have to go to the sleep lab and get hooked up to a million wires and not sleep at all.
I was going to say, how does that even work? Like, you'd never sleep there. I wouldn't.
No, I think my dad did that. He slept for 18 minutes the entire night.
That's very effective.
Yeah, and they said he didn't have sleep apnea. I'm like, that's not true. So we want to be able to just send home a really cheap, easy sleep study for these patients and have a doctor remotely read it, a sleep physician, and give us an idea of what's going on, and then we can treat it appropriately. There's a lot of different things you can do to answer that question. Myofunctional therapy to breathe better and breathe through your nose. We can take a 3D image of your airway to make sure that there's not obvious obstructions that need to be surgically fixed with ENT work. We can talk orthodontics. We can... one thing that I'm really excited about, and another thing that I'm going to start offering hopefully this year is we have the Solea laser to fix the tongue and lip ties, and it's a CO2 laser. There's a different use for it. We can laser soft palate tissue and we can tighten it up so we can open up people's airway that way. I have not done one case yet and I have not trained on it, but that is that really caught my attention, and we have the tools in the office already to do it. So that's going to be another thing. And we're going to have so many patients just from our dental patients, because there's so many that, have snoring or sleep apnea as a major concern. So excited to really help them on their journey.
Wow. I think adding these offerings into your office is just going to make it even more of a powerhouse, right? And that's kind of your goal, is to just make it a one-stop shop for people to not only have the tongue tie journey, have their hand held through that, but also as adults who are now dealing with these challenges, like how can we help you through your journey and get you functioning well?
Absolutely.
What do you do for your kids or yourself to ensure that you have optimal airway health? What does your house look like?
Yeah. We talked a little bit about the Myo Munchie. So my kids all chew on this little mouth guard, part of our bedtime routine that promotes proper growth and development of the jaws and widens that upper jaw and gets them breathing through their nose if they're doing it properly. And I hound them about actually closing their mouth and chewing appropriately for that long period of time. And anybody that uses one of those things, you get tired fast, So you
it is a workout, isn't it?
Oh man.
Yeah.
It is awesome to realize how weak we are in our face. We never work it out. We talk a lot. I do, especially, but we don't do those certain things. So that's what we do to promote that. And then I make sure that my kids are nasal breathing. We have 3 for 3 at this moment in time for nasal breathing in my house. So that's amazing. I'm not one of them. So I've taped my mouth shut a number of times. So here's a pro tip for you. If you can comfortably breathe through your nose for 3 minutes, and your kids too, you can tape your mouth shut with mouth tape that you can buy right on Amazon. And, I've had pretty good results with it, honestly. Most nights I keep it on. Sometimes I wake up and it's on the pillow or something. And then I got to dig it off of there because it's pretty sticky stuff. But it's been awesome. I've been sleeping better, and then I don't use it, and all of a sudden I'm breathing through my nose, and it's becoming more of a habit. So so those are some things that we're doing. My daughter, my oldest one, she's 8.5 now. We got palatal expansion on the upper and lower arches, and she stopped mouth breathing 1 month into that treatment. So that was really cool to see. I'm a big believer in that orthodontic work to open up those nasal passages. That's what we're doing. We're doing the whole gamut.
Yeah, this is a conversation that obviously not only on this podcast, but like in general, just needs to be continued. People need to be looking at their own family members, at themselves in the mirror, at their relatives, at their friends, and really being honest about what they're seeing and what they're hearing. And when you learn something like this, you can't unlearn it. Like, why not share it with your friends and family? So if you enjoyed any of these podcast episodes with Dr. Chris, please make sure that you're sharing them and helping to educate the people around you. Because right now, as we're sitting here, it is winter and it is sick season. And it's like, if we can do something that's going to help us to have less sicknesses in our life, isn't that worth it? If we can avoid sleep apnea and having to take 8 to 20 years off of our life, isn't that worth it?
Sleep better. If we can help our kids behave well and just feel good and learn well in school, that's what we want. We want us all to thrive. So this is like the foundations. This is where you should be looking first.
Yep, prevention is worth an ounce of prevention is worth a pound of cure, right? So if we can prevent it, we'll see these little ones, great. If you're an adult, all hope is not lost. I promise you that. Like, everything might have stopped growing, but at the same time, we can grow as individuals and learn things and treat them. So if you or a loved one know that, or if you have someone that is stopping breathing at night, witnessed sleep apnea, I mean, I can't overstate that. 8 to 20 years off their life. You say those things to them, that'll get their attention. It's like, just get a sleep study. That's all I'm asking. Go to your doctor and say, I want a sleep study. Give Wisconsin Tongue Tie Institute a call. We'll get a sleep study for you, and we'll figure out a path, and we'll help you. But ask someone. Like, don't let it go unnoticed. Otherwise, we're going to have a bad ending.
Yeah.
Thank you so much for sharing your knowledge with us through all 4 of these episodes. And I think to wrap everything up, I would just love to ask one final question of, what do you love most about your specialty?
That is a very hard question to answer, but I love that 5 years from now, I'll know so much more than I do right now, and I've been humbled by that fact. I had graduated from dental school, and we had our first daughter, and then the lactation consultant said the word tongue tie to me, and I'm not that kind of guy where I'm like, no, there's no tongue tie. I learned about that, but here we are 8 years later, and we're still learning. Airway is the next thing that I want to learn even more about and help more people and bring that to this area, because there's a lack of support, for these things. And that's what I love most about it is I don't know where we're going to be in 5 years, but we're going to go, and we're going to help as many people as we possibly can. So, and I got amazing staff too. I want to give them a shout out. I mean, I can't do anything without the people around me, and we're growing like crazy. And we got the 2 companies now, and it's been a lot of fun. It's been challenging. So thanks to my wife too for supporting me through all that and being my life coach. But it's been a fun ride, and I'm looking forward to the next chapter.
And thank you again for what you're doing, not just for the people in our community, but also for the dental industry, and being a leader there in helping hopefully other dentists open their eyes that even if they don't want to specialize in this, they should at least be aware of it. So thank you for making a difference.
Yeah, you're welcome.
And thanks for coming on the podcast. We had a lot of fun. It was great conversations.
Oh, this was great, guys. I'm a podcast rookie, but I guess I'm not anymore.
No,
so
there you go.
That's great. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.